Hi, Cynthia Tieche here with Dr. Tieche from the Recharge Clinic living room.
Family room / den.
Yes. So, how are you doing tonight?
Wonderful. May already.
Yes, it is May. May. Oh my gosh. Well, that makes me happy because it's summertime. So that means pretty
hot.
That
means hot.
It pretty much means nothing when you're an adult because it's like, yeah, summer vacation. And you're like, oh, wait, that's right. I still have to keep working.
Doesn't exist.
Well, we have a fun topic tonight. We are talking about medical marijuana.
Mm-hmm.
Yeah, this is a big topic. A lot of people have a lot of questions about this. So we're here to set the record straight and answer questions. And for today, because tomorrow it might change.
That's absolutely
the freaking
case.
Changes so fast. What's happening in Florida with the laws and with what's available, it just is always happening. So we're going to answer your questions. Dr. Tieche approves people for medical marijuana here at this office. So this is something that we deal with every day. So we really do have a lot of great information to give you. So if you have questions and you're watching this live, ask them in the little comment section and we'll try to answer them. And if you don't watch this live and you watch it later and you have questions, you can always still comment there. We'll get the notification or message us because we'll try to answer as many questions as we can. So let's start with why medical marijuana? Why are people going to that instead of the conventional prescriptions for pain or for whatever? And what is it for? Lots of questions.
Yeah, there's lots of questions. I mean, and there's lots of curiosity about it. So marijuana, the plant medical marijuana, has been used really anywhere from history, and it was used for all different types of things. It was used to treat animals and people, and it was legal in the U.S. really all the way up until Prohibition. And then there was some people that came out with some hokey studies that said it was dangerous and it could lead to, other substance abuses and stuff. So it became under scrutiny, and it became illegal then. And it never really made resurgence to become a medical for medical usage. And there was lots of attempts really in the US to try and use it. But President Nixon signed into effect this thing where he made medical marijuana a Schedule I drug. Schedule I is the most highly restrictive drugs there are. And it stayed, and it was a temporary order that he put in it because while they were going to do some research on it to find out if it was safe to proceed or not, he got some bad information. And they made it a Schedule I drug, which was the most highly restrictive drugs of everything. Wow. It's like heroin and all of that.
Wow.
And it was a temporary thing, which has never been taken off yet.
Wow.
So it is still considered a Schedule I drug. That's why people get such high sentencing and stuff from that. Because it's up there like everything else, and it's really not. But that's what's happened. So there was multiple attempts in the U.S. There was a lot of little studies that were done and attempts to publish it, but people really with some incorrect knowledge and really with some political ideas really did not support it, so it didn't ever get pushed. Meanwhile, jump over to other countries like Israel and Europe and everywhere. They were doing study after study after study with CBD, THC, its medical effects, extractions and stuff. And to date, there's about 10,000 articles supporting the use of medical marijuana for medical purposes. So bring it back over here now. We know that it's been used over there with great success for things. And in place of many medicines, whether it be seizure medicines, whether it be depression medicines, anxiety medicines, sleep medicines, pain medicines, all of that. And so we bring it back to the US, and now what's happened is it's still never been really recognized federally, but states have taken it upon themselves really because of the public's petitioning of them to make it legal. So state by state, they've been kind of going and basically seceding from the government.
Which
saying,
is important.
It's important to know. So really, each state by state has said, listen, we're gonna drop out of that. We're not gonna support that this is really so bad, and we want to continue to use it medically. So it's important to know that it's really only been for the medical purposes. For all of the other purposes, it's still like recreational in Florida. And, if you buy it on the street, it's still considered like a bad thing, and it's got jail time and all of that. So for medically, you know, what the state has allowed us to do is to approve it for certain medical conditions. And it started out that the number of medical conditions was very restrictive. It might just be terminal cancer, people who had really severe pain, glaucoma, which is an eye problem with pressure in it, and seizures and things like that. A couple of very restrictive things. But they gave the latitude, they gave an out for doctors who prescribed it to, say, some other conditions that, you know, the physician might justify. And that area thankfully was there because it allowed us to really open up the door to prescribe it more generously to other people than people who are just basically almost dead.
Yeah.
Because many, many people can benefit from it. And if we have to wait all the way to that point, then it's not going to help anybody.
Yeah.
So they opened the door for that, and really they successively have loosened up that portion of the approval process. And so really it's more been, as long as people meet certain criteria, you know, they are approved by the state. So the system is a patient will fill out an application for the state, which is sort of a consent form that the state requires you to fill out, which is sort of a disclosure. They want you to have a rudimentary understanding of the process and what it is. And that gets submitted. You then have to have a certifying doctor examine you and speak with you and determine if your condition meets approval. I then, since I'm one, I would then submit my data or my evaluation to the state and recommendation. It then goes to the state with an application fee that the patient would pay, and then it goes into the approval process, which in the beginning was quite a long time. It was really over 3 months. It was really a problem because we had people who were in dire need of it, and then we still had to wait for 3 months to get it. Many people, you know, if they were end-stage cancer, they may have died before they even got it. It was really quite sad and pathetic, the process. But the process has been outsourced. That's when the state actually did it themselves, and they realized they were not doing a very good job. So thankfully, they outsourced the approval process to some other private company.
So to put that all together, if someone wanted medical marijuana, they would need to go to a physician who can certify them.
Right. And so they get that. That process is, after you do the application, you're approved within 1 to 2 weeks. At that point, you are then come in for a dosing appointment where you have actually the products prescribed for you, which is the dosing is really the equivalent of prescribing, because we don't really write a paper prescription for medical marijuana. In Florida, it's done on an electronic dosing site. So we put it on that site, and it's actually pretty creative because a person can go to any dispensary within the state and purchase products, and they have a record.
So let me just put that together, because you deal with this all day, but that's actually a lot of very confusing information for people who don't. So let me just put it together for them. So someone who is ill, who wants medical marijuana for reasons that we'll go over different reasons.
We're going to go over it.
So basically you would need to find that physician in your area that would be able to certify you, because you have to get certified, right?
Correct.
So you have to have a certification. So how do you do that? You go to that physician who certifies people. So not all physicians will. You meet with that doctor. You fill out your application, you discuss with them. If he feels, yes, you are a candidate, you should have this, then he goes into his website that's connected with the state.
Correct.
And puts that information saying, yes, I believe that this patient should have this. Then it's a little bit of a waiting game. It was long, but now it's kind of short. So you meet with the doctor, he submits it online. Now, in maybe a week or so, you get that notification that you have been certified. Now you go back and meet with that doctor again. Now here's where he can go in and give you a dose online. You discuss your dose. He discusses it with you. You come up with something together. And in 2 visits, now you're off to what's called a dispensary. So that's kind of like a pharmacy.
Right.
You don't go to a regular pharmacy. No. You would just go to the dispensary. And since it's all online, they actually know what your doctor has said you're allowed to get. And it's like a little allowance, right?
It is an allowance.
So you give them an allowance of this, and they can go there and get it. And that lasts about 70 days.
70 days.
And then they have to, if they run out of that, then they come back and you kind of go through, not that whole process again, just basically like a little refill kind of session with you.
Right. And that 70-day time period was set up by the state. And so basically we dose it. In the beginning appointment, we kind of go over the different options of what types of products are available, why one might benefit another, and be useful for them. And then they kind of start the process of treating themselves with that.
Okay. So we have some products here from a rep that they dropped off. Obviously, there's nothing real in here, but I have another rep that said, "Hey, where's my stuff?" So I said, "Send us some new stuff, and we'll put your stuff up here the next time." But there's many great dispensaries around there. So let's get into. So now that we know kind of the process of how to get your hands on medical marijuana, who do you believe is a great candidate for, and what is it really helping people for? What are the best things that it helps?
Well, interestingly, as we've been doing it, the main things it was approved for was cancer pain and really all of these other things, seizures, glaucoma, things that were these really chronic kind of significant medical problems. But really, in reality, on a practical level, it does work very well for pain, but there's a whole group of people that were left out. And there was a lot of people who had severe anxiety, panic attacks, insomnia. And those people right now make up the largest group of patients that we see. They also have, most of those people have some pain, but that's not their main complaint. And the reason being, there really are no good medicines to treat that group of symptoms. And honestly, those are the people that do the best. They really do. People who have anxiety and panic disorder and insomnia get excellent results. I mean, amazing results. Many of them come off of antidepressants, anti-anxiety medicines, and sleep. They are able to sleep for the first time ever. So that is really important because it's very satisfying. These people come back and they are just happy as they can be because many of them have not had symptom relief for a long time, and some of the things like anxiety have really prohibited them from doing anything.
Yeah, well,
they couldn't leave their houses. They couldn't leave their house. They couldn't do anything. Now there are some other things that we see people for. Tics, that's a neurologic problem, almost like a mini seizure, seizures and chronic pain. We see those. They work really well for those. There's just not a lot of those out there compared to the number of people who have anxiety disorder and panic attacks and insomnia. Those are by far the largest group.
Mm-hmm. Okay. So, what else? Seizures? Is it good for seizures?
Yeah, and it's great for seizures. I mentioned seizures as well.
And why? This is just maybe a dumb question, but why is it so many cancer patients want this? And what would be the best for them? And what's the reason that they are seeking this?
Well, it started out with cancer patients for really two main things. One was pain control, and that's part of it. But secondly, many of the people who are undergoing chemotherapy have two major problems. They become extremely nauseated, and so that's a problem from that. I mean, so much that they never want to eat. So they feel sick all the time. They feel like they want to throw up. And that's just because of the way the chemo agents affect a certain center in their brain and cause them to be nauseous. So the THC and CBD actually help suppress that nausea so that it actually takes it away. And that was one of the first uses that it was approved for, was that. And there was some synthetic THC CBD things called Marinol. That was a synthetic form. And then it became used to be the more natural, what we call the phytocannabinoids, which are the ones that actually are plant-based, not synthetic. And so that was, so that's another reason, appetite. In some of those patients, it actually helps stimulate their appetite because what's another thing? They're so nauseous all the time. They don't feel good. They don't feel like eating. So one of the things they have to do, since they're fighting off the disease, they're being bombarded with poisons, is to maintain their strength and keep up their immune system. And so that's another thing that actually THC and CBD help support your immune system. And it's a common, not a well-known fact, but it actually does. Wow. CBD predominantly does that, supports your immune system. So it helps boost your immune system. So it actually helps those people. And that's why it works very well for inflammatory medical conditions, because it helps suppress that.
So I don't know if it's time to move on to this question or not, but so you keep mentioning CBD and THC. Let's talk about those. What are they? What are you talking about?
Well, within the medical marijuana plant, there's about anywhere from 160 to 200 active chemicals that have been described. As far as they have some kind of thing that they'll do to you. But really, predominantly, it's really come down to two major ones that are used. One is CBD, which is cannabinoid oil. I mean, it's kind of a hard one to say. And then THC, which is tetrahydrocannabinol. So anyway, there's two. I'm not good at saying them, but those are the two main ones. And they have almost opposite effects. So CBD, for me not being able to say it, and THC, for me not being able to say it, have different effects. So CBD is primarily one that works indirectly on the receptors in your body. So that means it doesn't directly work on them. It supports your receptors to work on pain. And that's one of the main things it does. It helps with pain relief, and it actually does have some calming, sedating effects. So that's kind of what it would be used for. CBD, it works for anxiety a little bit and sleep, but it's not going to get you high at all. It has no mental effects as far as psychoactive things. So in other words, it doesn't get you high. You don't get euphoric from it. THC, on the other hand, is primarily responsible for that. That's what that's been associated with. So if someone were to smoke pot during their lifetime and get high, that's what it was. It was almost all THC. But we've taken that THC now out of that plant and refined it quite a bit. So you're not going to get all of that same effect as you did. So really, we found that there are strains of THC that have different really benefits. Like there's sativa, indica, things like that. Indica is very potent for sleeping and sedating. And that's why when people used to smoke pot and they say, oh, all it does is make me want to sleep and blah, 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 on the couch. And it did, because it was very sedating. So they've taken that and isolated that for people who have insomnia, and they use that to help them sleep. Sativa is very calming. It doesn't really get you high. And so that people can use that for anxiety and panic disorder, and they can use it without losing their ability to think clearly, but yet having great response from that.
Yeah, it's really cool. They've really taken it and been able to piece together ways to help people in different with different needs. And like someone mentioned, that not all strains increase your appetite. So getting the right strain for whatever it is, if you do need to increase your appetite, there's a strain for that. If you don't need to increase your appetite, but you need to increase your energy,
and in fact, that's a question that most people ask me: is this going to make me gain weight? And I have not seen that at all. I have not had any of our patients go on binge Dorito things or anything and eat a lot. They have not. I have not seen anybody gain weight when it's used judiciously. So that's not been a big problem for people balloon up on it or anything like that.
And so my next question to move on to is, a lot of people, I think people are becoming more and more aware, but people who aren't in the business like we are that aren't aware, they kind of think that, oh, I've got my medical marijuana card, now I'm going to go smoke pot. And actually, smoking the flower did just become part of what you can get, but really most people aren't even smoking it. What are the different ways? And we can use this as an example that people are actually getting this medicine.
Well, there's a couple of ways, like traditional medicines. There's not one up here. There's a capsule, and that's one way that people take it. There's vape pens, which what these are, and so vaping or inhaling it is really one of the most common ways of doing it. And what that involves is they've concentrated this down into an oil. It goes through a little heating element, and this basically a similar thing to an electronic cigarette, and it becomes vaporized, and they inhale it, and it becomes very rapidly absorbed. So they can use anything in that. I mean, they can put THC, they can put CBD, but most commonly what people are doing is blends. They're having a blend of THC and CBD because each one offsets some of the bad side effects of the other. So people who don't like getting high or that feeling of losing their mind from THC, CBD pulls that down. So that's kind of its counteractive. Now, THC helps give the pain relief and go to pain relief and calm people down, or on CBD. So they work very much hand in hand, so people use a blend. There's topical blends that people will rub on areas that are uncomfortable. There's a sublingual, which is an oral base, which is this one and this one, which basically you apply a dropper of the product, which is an oil, and then you put that under your tongue, and it's absorbed very quickly, really. Or inhalation, sublingual, capsules. Those are in order of how the quickest they work to the slowest. And then there's topical, there's patches. And patches are a slow release form of either THC, CBD, or a combination. And I say that because it is kind of confusing. People, well, why is there so many options? Well, there is a lot of options because that's just how it is. And that's kind of a good thing because it makes it available and makes it really an opportunity to get a lot of people fixed because there's so many different options. There's not one size fits all. Honestly, many people have to experiment a little bit and find out what works best. And more often than not, they will find something that works really well for them. It just takes a little bit of trial and error.
And that's such a good point, because we've had a lot of people, and we've heard when talking to reps at at some of these dispensaries is that some people say, oh, that didn't work for me, but it can work. It's just trial and error and finding what works for you. So the right form and how much and which strain and everything, but there really is something for everyone. And a lot of people think that, oh, people are just getting high. No, some of these you really aren't getting that from at all.
No, most people are not at all. That's not the case. Most people think it's kind of, that's what the main role of it is. It is not. Most people don't want it for that at all. And, so that is part of my explanation process when I'm dosing people, particularly people who are unfamiliar with that. Many people are used to the traditional medical system where I'm going to give you a pill, you take it every 4 hours, and this is going to make you better. So here all of a sudden I'm going to say, well, here's this product. You're allowed to use this much during the day. And really you can use this one, and you can mix them up. And they're like, wow, overload. What do I take?
Yeah.
What am I going to work? So that some people do, and they'll go and take one and they say, well, it didn't work. Well, it's not. And, actually, if you took, one of anything, it's probably not going to work. If you took one blood pressure pill or took one antidepressant, it's not going to work either. So I really try to encourage them, and that's what I spend more time on than the different strains, is telling them, be patient, be vigilant, try to keep making it work, because it will.
Right.
Work with the people at the dispensaries. They're extremely knowledgeable. They have a tremendous knowledge base of their products and how to make it fit for your problems. So that's the thing that is really important to know, that you have to keep being persistent and trying these different ones.
So we have a question, and this is great. I'm glad this person asked this because we did need to address this, is what about it showing positive on a drug test?
Well, so the product that shows positive is a breakdown product of THC. That's the thing that is tested for in a drug test. So if you get any of the medical marijuana products that have THC in them, and you will test positive for up to several weeks after using it, because it hangs around in your system. It's not the THC, it's the breakdown product. It gets absorbed into the fat, and it kind of is slowly released then. And so, yes, you will test positive. If you take CBD, but if you use pure CBD, which has no THC in it, you will not test positive, because the breakdown products of CBD don't go that way. So the problem is, yes, if you have some problem, that you need some THC, yes, you're in a normal
right. And
situation.
meaning that if a drug test, who's getting drug tested? Well, if your job says you're not allowed to have this and we do drug tests, well, you're going to test positive for it. But and having this from a doctor saying that you are prescribed this or certified for this, if your job says that you're not allowed to have it, then you're not allowed to have it. And there's nothing that you can do about that, unfortunately. And we see that problem, which isn't really, it's kind of crazy to think that they'd rather have you drugged up on Xanax and pills when you could be taking something natural and safer. But that is the way it is, unfortunately. So for someone who does have to take a drug test and can't take this, then what would you recommend in this situation?
Well, I would recommend purely CBD, the CBD-based product that is THC-free.
And so you wouldn't need to go and get your compassionate use card or anything like that. This is something we're talking about from just CBD oil.
Yeah, so you could use CBD. So CBD is also extracted from hemp plants. But if you get what's called full spectrum of that, that means it's compressed all the oils out of that plant, because there's a small percentage of THC in that CBD, you would test positive. So what you have to get is what's called an isolate, or a narrowed spectrum of that. And that's basically, they've taken the THC out, and you will not test positive because you will not have any THC in that.
So, and that is really where people are getting that's why they're going to these smoke shops and getting a lot of things like that. And I think you have to be careful and make sure that you're getting a really good product. We carry some products that we personally like. Charlotte's Web is one of them. They're great. If you're not in our area, I would research who has them in your area. We don't carry many lines. That's really our main line that we have.
That was one of the main ones that came out. That was one of the original ones that came out. And, it's been very well studied. Their products are very consistent, and they meet up to standards. The problem is the demand for CBD has become exponential.
It's in everything now. It's like in food.
It's
everywhere.
So it just goes to make sense. The demand is high. People are seeing opportunity to sell it and make money. The problem is now, what's on the other end of where it's coming from? What are the sources it's coming from? What is the quality of it that is coming? What is, since when it's sold in, the medical dispensaries, it has to be tested for its percentages and accuracy. When it's sold as a nutritional supplement, it's not quite as accurate. And so that's a problem. We don't know where it's coming from. We don't know if it's coming, off of some back sweatshop in China or another place like that, which are flooding the markets with these CBDs, or it's really a high quality product that people want. I mean, because the thing is, they're dumping in this with all of the sorts of oils that are in there, and you're taking them. Well, this is a plant-based thing. We don't know if it's been grown with pesticides, if it's cut with solvents, anything. That's the kind of stuff that we have to worry about. It's the contaminants that are in there. We're taking something to help us feel better, but this could be poisoning us as well if we are not careful of what you're taking. So, yes. It's kind of an expensive product compared to some other things, but, yeah, you can buy it really cheap in some of these convenience stores. I'm not really sure what you're getting. And so, I'm not saying it's all bad, but I'm just saying buyer beware. Please do your research and make sure that you're getting what you want to get.
Go to a reputable place that has it. We carry CBD water here, which really, like I said, we don't have a lot of different products. We try to keep it simple. We try to keep to what we like. And one thing that we do sell a lot of is our CBD water, which is alkaline water with magnesium and other minerals in them. And we love it. And so that is a full spectrum CBD. So if you are someone who cannot take a chance in testing positive for anything, then that water might not be for you, but we have another one that is an isolate that would be good. And like I said, these are not medical marijuana. We don't carry medical marijuana in our place. That's only at a dispensary. But these are products that maybe you don't want to go to medical marijuana yet, and you want to try just the CBD ones first from hemp before you take that step. We offer some here.
Yeah, and I think there's something important to know is that it's not full throttle. I think that these products work in small doses. CBD works in really small doses for minor things, minor aches and pains, headaches, a little bit of anxiety. You don't have to be on, be on anxiety medicines and all of that to say, oh, I got to have that. Yeah, we all have these days where we want to rip somebody's head off or do something. This stuff brings it down a notch. You're not going to get, drunk or anything like that. It's going to help calm you down. It's safe for children. Many children are taking it. I mean, it's really being used quite a bit in children now. Pets, it's really common. It's really out there for a lot of stuff. So, you have to.
Do you find a lot of your patients are coming off of their opioids and prescription pills because they're getting on medical marijuana?
Absolutely. Yes. The first things that come off really quickly are the anxiety medicines and the sleep medicines. They come right off. And so the first thing is stepwise. I want to be clear about this. It's a process. It's not the minute you start your medical marijuana is the day you stop your medicine. Absolutely not. If you've been on these things for a long time, first thing we do is get you on a stable amount of this, something that's working effectively for you. Then we start the weaning process off of that very slowly, depending on the medicines you're on. Some of them you cannot just stop abruptly. So we want to take them off slowly and then keep monitoring you and adjusting that. But many people are getting off of all of them and getting their lives back because in addition to calming you down, these anxiety medicines just affect their neuron function in your brain, so you're a little bit dulled. People don't feel like they're awake. They feel like they're muted and blunted.
From opioids and all those.
And really all sorts of antidepressants and anxiety stuff. So it kind of makes them feel more awake. So that's one of the big things that happens is that you would think, well, I'm going to get on marijuana, but I'm going to actually be more alert than I was before. You are. It's not that kind of a thing where you lose that when you become sedated.
Okay. All right. Well, we are going to wrap it up today. Did something happen to the video? Still on? We're going to wrap it up, and we'll see you guys next week. Thank you so much for watching. If you have more questions and you missed us, please just message us or comment below, and we'll get back to you shortly. So we will see you next week at 6 o'clock on Thursday.